cholesterol levels are bound to get affected in a negative way in any liver disease, because liver is a very important and primary organ involved not only in cholesterol synthesis, but also partly in the cholesterol uptake through bile. So what happens is when cholesterol is synthesized from the liver and the food, it ultimately goes into your vessels, into your arteries, where it is transported with the help of certain proteins, which are called as lipoproteins. I will get into the details in the further slides, but just to tell you a brief, that liver has a very important role, not only synthesizes cholesterol, few cholesterol deposits are then taken into the vessels, and then partly it is also brought back to the liver, where it is, assimilated along with bile. So therefore, liver has a huge and a very, very important role. So if your liver is healthy, your cholesterol levels are most likely to stay in control. Now, what are the functions of cholesterol? Cholesterol is not always bad. We need to understand anything in moderation, anything in normal levels is good. So in general, cholesterol has several functions in our body. You all might have heard of this vitamin D, because a lot of people in our country or even outside the country are facing vitamin D deficiency. So cholesterol is in fact a precursor of vitamin D. It leads to the formation of vitamin D in the presence of sunlight. Therefore, cholesterol in normal levels is needed. It also helps to maintain the normal cell membrane homeostasis. Homeostasis means normal functioning, the normality. It helps to establish the normality of the cell membrane and also the fluidity of the cell membrane. Helps to function the cells of our body in a very nice and appropriate way. Moreover, cholesterol also insulates nerve fibers. So therefore, it helps in your normal nerve functioning as well. And cholesterol is needed in bile acid synthesis. Most importantly, cholesterol also helps to form several hormones, such as aldosterone, cortisol, progesterone. These are various male and female hormones. And cortisol is, the fight and flight hormone, which I told you even in the previous lecture, in the previous session we had taken on weight management, insulin resistance. We kept on focusing whenever you have stress, cortisol levels will increase. So therefore, everything is linked, all the hormones, your cholesterol, your diabetes profile, insulin resistance, everything is connected and everything is linked. Now, it's not only cholesterol. There is a very other important component that you must have seen in your blood reports is triglycerides. So you have cholesterol levels, total cholesterol levels, and certain subsets of different types of cholesterol, but also triglycerides. So triglycerides are also an important fatty component which help to provide a good source of energy. But again, whenever it is in excess, it is going to be bad. Okay. Why it's going to be bad? Because excess triglycerides can cause hardening of the arteries and can cause cardiovascular disorders. Similarly, cholesterol will also lead to several cardiac issues. So let's move further. What is normal cholesterol level? What is normal triglyceride level? How much is normal? How much is not too much? So the ideal levels of total cholesterol, ideally it should be less than 200. When we say it's borderline, when it is still below 240. But anybody who has comorbid conditions such as fatty liver or diabetes, they have to maintain the ideal levels of total cholesterol, less than 200. For them, even borderline is not acceptable. And anything above 240 is going to be too high. Then let's talk about different types of cholesterol. What are the levels? So you might have seen in your lipid profile reports, there is something called as LDL cholesterol, there is HDL cholesterol. So LDL cholesterol is also called as bad cholesterol. Bad cholesterol because this cholesterol deposits in your arteries and clogs up your arteries. So therefore, the ideal level should be less than 100 and not more than that. Anything which is above 150, 160 is going to be high. For a normal person like me who doesn't have any comorbidities, I can still accept a level of 130, 140. But for somebody who has already a lot of comorbidities, diabetes, heart dysfunction, liver dysfunction, you have to maintain the LDL cholesterol below 100. Now let's talk about the good cholesterol. good cholesterol is also called as HDL cholesterol. So good cholesterol, of course, should be in good levels. It should be above 50, 60. That is a normal range. But it shouldn't go too low. It shouldn't go less than 40 or less than 45 because that will not be good for you. Good cholesterol is needed. Then we have triglycerides, which I told you, if in normal levels, it's helpful. Can I request, Shweta, can you mute everybody from your side?
कोलेस्ट्रॉल कैसे चेक होता है?
Everybody, I'm requesting everybody to please mute yourself. If you have any questions, please type in the chat box and we will take up all the questions towards the end. Everything, all the...
पे ऊपर है और 240 अगर दिखाया ना मतलब बहुत सीरियस है.
Yes, 240 से
मेरी बात
Doctor, you have muted yourself.
You can hear me now?
Yes, I can hear you.
Yes. Sachin, I request you to please mute yourself. We will take all the questions towards the end of the session. Everything will be taken up. You can type it in the chat box. Okay?
लेकिन कोलेस्ट्रॉल मैडम कैसे चेक होता है?
Cholesterol blood test होता है उसका. There is something called as lipid profile. I request you, please type your questions in the chat box. We will take all the questions towards the end. मैंने आपको बताया था ये ब्लड टेस्ट में होता है. There is something called as lipid profile. और उसमें हमें total cholesterol, LDL, HDL, triglyceride के levels पता चलते हैं. We get to know the exact levels of all of these in your lipid profile. It's a normal, regular blood test that you can take up anytime. So I just request you to mute yourself and we will take all the questions towards the end. Okay, then I spoke about the different classes, HDL, LDL. So basically, whenever we talk about VLDL and LDL, they are considered as bad cholesterol and HDL is the good cholesterol. Why is HDL good cholesterol? Because it is anti-inflammatory. It will stop any inflammation. And in fact, it will even stop the deposits of LDL, that is bad cholesterol, in your vessel. So therefore, it is anti-inflammatory. While when we talk about the bad cholesterol, which is LDL and VLDL, that is pro-inflammatory. That means it will cause increase in the inflammation. And we don't want that. We don't want an increase in inflammation. So LDL cholesterol is the one which is most commonly raised. You know, in your blood report, if you check, therefore your total cholesterol would be high. The main responsible factor is the LDL cholesterol. And therefore we must be watchful about it. Now let's see bad cholesterol versus good cholesterol. I already told you LDL cholesterol is the bad cholesterol. HDL cholesterol is the good cholesterol. So we have to increase the good cholesterol, that is HDL, and decrease the bad cholesterol, that is LDL. Now you can see an image below where I have told you how your junk foods are the cause for bad cholesterol, while healthy foods are responsible for good cholesterol. Of course, the detailed dietary aspects will be taken up by our head nutritionist Shweta in the next session once this presentation gets over. But yeah, in general, healthy food helps in building up good cholesterol. Now, any increase in cholesterol is an alarming thing. So please don't take it lightly. Please don't think that, you know, cholesterol is an issue for everybody and I just have slightly high levels of cholesterol. That's not the way you have to think. Even if there is a mild increase in cholesterol levels, the ranges of which I've already explained to you, please understand the significance of it and please contact your health experts. Here, the role of a doctor as well as a nutritionist will be extremely important. And if you see, our plan of working at Reset Wellness is such that we emphasize on 4 pillars. Not only the medical pillar, but also the nutrition, yoga, physical activity, as well as your mental health. Because any increase in stress will also cause an increase in cholesterol levels. Okay, so we need to focus on all the pillars and gauge it at the right time before it goes too overboard, before the levels go too high. Understand it. Okay, now I told you about the entire cholesterol cycle. So liver produces part of the cholesterol, LDL cholesterol deposits in the arteries. HDL cholesterol is a good cholesterol. It helps to, in fact, remove the deposits of LDL and sends it back to the liver for assimilation. So that's how the cycle is. We want less of LDL and more of HDL. How common is cholesterol issue or lipid issue in India? When we talk about lipids, it's cholesterol as well as triglycerides, both of it together. Whenever there's an abnormality in either of their levels, be it cholesterol or triglyceride, the term used is dyslipidemia. Dyslipidemia, that means something is dysfunctional, something is not normal. So this was a pan-India study where more than 2,000 volunteers were recruited into the study all over India. Healthy people from India were recruited and their lipid profile was checked with the help of a blood test. What they saw is among these 2,000 people who were enrolled, more than 1,600 had dyslipidemia, either more cholesterol, more triglycerides, one of them they had it. That means almost 80% of the healthy population in India had cholesterol issues and they did not even know it. So dyslipidemia is that common in India. And this was a survey conducted across India by ICMR, the Indian Council of Medical Research. It was a very huge scale survey. Only 20% of the patients were there who did not have any lipid abnormalities, while 80% were incidentally diagnosed to have some problems with their lipids. Okay, let's see the consequences of dyslipidemia. Whenever there's dyslipidemia, it can lead to deposits in your arteries. It can lead to oxidative stress in your vessels. It can lead to stress in your body. It can lead to thrombosis. Thrombosis means any blockage in your vessels that can happen. It can lead to your vessel dysfunction, your arterial dysfunction. It can cause inflammation and insulin resistance as well. We have already spoken about insulin resistance in one of the previous webinars. So I'm sure anybody who has attended the previous webinar, you can correlate better. And when we have all of this along with obesity, that means insulin resistance, abdominal obesity. Obesity also we covered in the previous webinar. Along with dyslipidemia, it leads to metabolic syndrome, which is a very difficult condition to treat because you have several abnormalities. So therefore, please understand and take charge at the early stage. When you see slight abnormalities in lipid profile, immediately understand, take charge so that you don't get into the stage of metabolic syndrome. Okay, how does cholesterol affect the circulatory system and the heart? I told you, whenever there's increase in cholesterol, the cholesterol will deposit in your vessels, in your arteries. And it happens in a step-by-step manner. Of course, it doesn't happen overnight. So the earlier you pick it up, the earlier you can treat it, the earlier you can modify your lifestyle. So this is a normal artery. Yes, Shweta, you can hear me?
Yes, you're audible. Yeah, doctor, sorry.
Yes. There's a normal artery. Then what happens is there are initially few deposits of cholesterol. This progresses and there's a further increase in cholesterol deposits. Ultimately, the deposits increased so much that the artery is narrowed. So basically, your blood doesn't have space to flow, and therefore there can be a blockage. So you don't want to get into this stage, right? You do not want to affect your normal circulation. You do not want to affect your normal heart functioning. So therefore, pick it up at a very early stage and understand the significance of preventing it as well as treating it. So this is a video depicting how cholesterol deposits in your arteries. See, you can see this yellowish lipid deposit, which is your LDL cholesterol. See, it is depositing slowly. It is the deposits are increasing in size. They are blocking your vessel. And this is in fact even affecting your normal blood flow. See, the size has increased so much now, even the normal blood flow is affected, and ultimately it is blocking your RBCs, your blood flow to go through it. That is the last stage. So of course, if there is any blockage, if there is excessive cholesterol deposits in your blood vessels, it will cause a decrease in blood supply to your heart as well. And therefore, your heart will not be able to function. Firstly, the heart is not receiving enough blood. Your heart arteries, which are called as coronary arteries, are not giving enough blood to the heart. And therefore, the heart is getting, overloaded. With less blood, it has to supply and pump to the entire body. So therefore, the entire body is going to get affected in the long run due to the heart. So take charge, understand how important it is to control your lipid profile to normalize your cholesterol levels. Now, you might have heard of this term MI, myocardial infarction. Also, in simple terms, it is called as heart attack. Heart attack has several factors, which can lead to a heart attack, such as exercise, alcohol, blood pressure, diabetes. But if you see here, lipid abnormalities in your lipid profile is the most important attributable risk factor leading to heart attacks. It is the most common and the most important factor which is leading to heart attacks. So therefore, for preventing, such kind of situations where you have an overload on your heart, I request you all to please control your cholesterol levels and bring your lipid profile to normal. You might think that, like we mentioned, if the lipid profile is too high, then it's a concern. If it is mildly high, it is not a concern. So like I told you, don't take it lightly at any level, because there is a study which was conducted in Korea. So it was a large-scale study conducted in Korea, which showed that even mildly abnormal lipid levels, they are associated with increased risk of MI, which is heart attack, and stroke. So stroke happens when there is a blockage in your vessel in the brain, cerebral vessel. So both of this were increased. Chances of myocardial infarction, heart attack, as well as stroke were increased when the lipid levels were even mildly raised, mildly abnormal. Therefore, please don't take mild levels also lightly. See, I told you about LDL cholesterol, which is bad cholesterol. So whenever there is an increase in the bad cholesterol, there is a proportional increase in the chance of a heart disease. You see this graph, how LDL cholesterol is increasing, and also simultaneously, the chances of coronary heart disease are increasing. Now, there are different pharmacotherapies or treatments which are available to treat your lipid abnormalities, to bring your cholesterol to normal levels. Different classes of medications are there. Statins are the most common because they target not only your LDL and HDL cholesterol, but also the triglycerides. So it's an overall approach, triglycerides and total cholesterol. But remember, you cannot self-medicate yourself. You cannot prescribe yourself with medications on your own. It has to be done by your doctor. So please don't read up on Google and try to be a Google doctor, because medications sometimes are unavoidable, but every medication has a side effect. So the goal is to be at the lowest possible dose of a medication. The goal is to prevent any need for medication. And if you have to take a medication, the lowest dose. When you are on medication, the goal should be to reduce the dose even further with lifestyle changes, combining lifestyle changes, physical activity, nutrition aspects, your yoga asanas, combining all of this. And then you might even get into remission or reversal of your dyslipidemia. Now let's talk about the treatment for dyslipidemia. So we spoke about the treatment, the medical treatment, the medicines that are there. But I told you every medicine has its own side effects. Very common side effects of statins is myalgia or body pain. So try to avoid that where possible. Try to bring in more lifestyle changes in your life, which can control the dyslipidemia. So this was a study published in the American Journal of Physiology, which showed that there were several volunteers that were enrolled in the study who had abdominal obesity and dyslipidemia. Mainly, there was increase in VLDL, bad cholesterol, and decrease in HDL cholesterol in these patients. Just after 1 year of lifestyle modification in terms of physical activity and a healthy diet, 1 year of that caused a complete reversal of the scenario. So VLDL cholesterol levels decreased drastically, and HDL cholesterol, which is a good cholesterol, that levels increased. And see, somebody who was as obese and not so fit, became something like this towards the end of 1 year. So 1 year is also not required. You can start seeing the changes in 2 to 3 months itself. Therefore, we advise anybody who enrolls with us in our program that, once you integrate the lifestyle changes that we tell you and we supervise you, after 2 to 3 months, we expect a considerable change in your lipid profile, a positive change, and we request the patients to repeat the lipid profile after 2 to 3 months. And it has been seen in many patients, we have seen remission and reversal. So American College of Cardiology also mentions that whenever there's an increased risk for cardiac diseases, like due to increase in cholesterol, or whenever there is chances of type 2 diabetes, if a patient has any of these things, or metabolic syndrome, lifestyle modification has to be the first approach. You have to go in for positive lifestyle modifications in terms of stopping the addictions, controlling your body mass index, BMI, controlling your weight with the help of physical activity, nutrition aspects, and some form of health coaching. So this is a very guided approach. It is very difficult to do it on your own. So the situation is similar to, going to the gym. Why do people take a personal trainer? Because they don't want to injure themselves, right? So you need some form of guidance in the beginning. And that is what our approach focuses on. Let's talk about what the Endocrine Society tells how to manage dyslipidemia. So the Endocrine Society tells that whenever there's a dyslipidemia, firstly, you have to understand the clinical features. Understand if the patient has some comorbidities, some heart issues already, some family history, abnormal sugar levels. Understand all of these conditions and go for the lab evaluation. Go for the blood test, which tells you about the total cholesterol, LDL cholesterol, HDL, triglyceride levels. Understand what is raised, where you need to focus upon. And accordingly, there will be a design of the plan that has to be put forth so that you can correct it in the form of physical activity. You have to reverse the obesity, decrease the alcohol intake, modify your diet. All this has to be taken into account. And with the help of this lifestyle modification and medications, both of it, there can be a drastic change in the dyslipidemia and the lipid levels will come to normal. So that's it from my side with respect to the medical aspects of cholesterol. Thank you so much for hearing me out. I was glad that some people had questions, and I'll be very happy to take up the questions towards the end of the session. Please type your questions in the chat box. We are there to help you, and we are there to address all your concerns. So thank you so much. Shweta, over to you. Shweta, would
Thank
you
you
like to
so
share?
much, Doctor, for this insight. Just give me a second to share my
Sure.
screen. This was lovely presentation by Dr. Tha, and I would have been from the medical aspect. Now I'll take you through the dietary guidelines for hyperlipidemia or dyslipidemia, which is lower level of HDL, that is a good cholesterol, and VLDL, hence the total cholesterol. So what exactly is cholesterol, and what are the normal levels for cholesterol, which major part of it has been covered by Dr. Nishtha, so I wouldn't really take much of time on this. Good cholesterol is your HDL. HDL is your high density lipoprotein. That is a good cholesterol that keeps our heart health in good place. LDL is bad cholesterol, that is low density lipoprotein. And of the fact that our body has not only in terms of the body fat, but also in terms of the fat. We'll slowly heart area, which increases your cardiovascular risk. You call it high cholesterol, your doctor calls it hyperlipidemia, as I said, the several disorders that result into extra fat and also in your blood. All of these one by one, obviously with the help of health professional who will actually understand your requirements and will guide you accordingly. Doctor has covered the
sorry to
normal
interrupt,
range
Shweta.
of all desirable